Yeah, so Paolo Strati is one of our very promising junior faculty who set out to explore what the outcomes for patients who receive frontline lenalidomide in combination with rituximab for previously untreated follicular lymphoma at our institution. I think why this is novel is we're one of the few centers that has a pretty large cohort of patients who've had frontline lenalidomide rituximab, and though we're all very interested in moving to chemo-free options, the question is whether or not your frontline therapy will impact your subsequent lines of therapy. And with this being sort of a novel approach, he set out to explore what do we do for those patients who relapse post lenalidomide rituximab. And it's a small number. It's less than 35 patients. That speaks to the fact that out of the nearly 152, there was a quite favorable frontline progression-free survival with a little over 7 years of follow-up. But essentially for those patients who did relapse, there were a number of approaches applied. And though these numbers are quite small and it's hard to really pick a preferential sequence of therapy, it did appear that those who received bendamustine in combination with CD20 may have had some more favorable outcomes than those who had targeted therapy or were even enrolled on clinical trials. But again, the message from this study is that patients who get frontline lenalidomide and rituximab have quite favorable outcomes. They're able to be successfully managed with subsequent lines of therapy, and introduction of chemotherapy such as bendamustine and later lines of therapy still results in favorable outcomes.